Calcium and heart disease. Is there a link? Hi, I'm Dr. Meschino. You know, recently there have been a few studies that have shown a link between taking calcium supplements and a mild increased risk of heart disease and heart attack. Now, these are not studies that are intervention trials. These are not studies where they took people and they deliberately gave them a calcium supplement and they gave another group the placebo and they waited 5 years or 10 years. Those are really definitive, more definitive types of studies. These are studies that are sort of retrospective studies or just following groups over time and looking for correlations. What we do know is that in dialysis patients, if their blood calcium rises, that it tends to calcify the plaque in their artery wall and it gives them an increased risk of cardiovascular disease. So these sort of prospective studies and retrospective studies that have been done suggest that the same thing may happen to us, that if our blood calcium rises too quickly, we may be calcifying the cholesterol in the artery wall and making it harder. And when you calcify that plaque, it's bad news because the pieces can break off more easily and lodge in narrowed areas and produce a heart attack or a vascular event. So there's some cause for some concern. At the same time, you need enough calcium to prevent osteoporosis. In fact, calcium and vitamin D and supplementation with the icariin flavonoid are proven not only to prevent osteoporosis, but also to reverse osteoporosis and osteopenia in people that have it. So the studies show that, but I've seen it with my own patients where their bone density was low, and giving them the right supplementation program, their bone density actually increased over the course of a year on bone density testing. So we need to exercise caution and have a smart strategy around calcium supplementation, but not abandon it altogether. Because 1 in 4 women over the age of 50 develops osteoporosis, 1 in 8 men develops osteoporosis. And if you have a fracture, especially a hip fracture, you know, it results in not only disability, but death. 20% of women die in the first year, 34% of men die in the first year due to complications. The good news about calcium supplementation is that it helps to lower blood pressure to a certain degree in many people. And there's evidence to suggest it reduces the risk of colorectal cancer, which is the second leading cause of cancer death. So what I did is I wrote a short review paper on how to approach calcium supplementation based on the latest studies that we see. I think everyone should read it. And I also provided links at the end of my article to the published studies on calcium and heart disease so you can read some of these reviews for yourself. I think it's a very important health issue right now. It's very topical. So click on the link, read the article so you can see my updated recommendations on calcium supplementation. I think it's a must-read for every adult. Now remember that at MeschinoHealth.com you'll see my other research review papers, you'll see footage from my live professional seminars, other downloads and resources and videos I've created. They're all there to help you lead a long, healthy, functional life. All my teaching materials and research review papers have all the evidence, all the scientific references in them, so you're getting only evidence-based from me, information from me on any health topic that you're looking for. So you should use MeschinoHealth.com as an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.